For surgical patients, a quick recovery and return to normal day-to-day activities is essential. In the traditional system of care, however, recovery after surgery can be delayed. To reduce the risk of complications and enable an earlier return to normal activities, Mainline Health developed their Enhanced Recovery After Surgery Treatment Pathway, or ERAS. They developed guidelines to identify ERAS patients and standardized patient education templates, nursing care plans, and order sets. The pathway also focused on optimizing patient nutrition, multimodal pain management, goal-directed fluid therapy, early ambulation, and patient education. The pilot program among colorectal surgery patients not only limited in-hospital opioid use, it also reduced post-discharge opioid prescriptions. And other results include a 12% improvement in day-of-surgery ambulation, a decreased average PACU pain score, a decreased oral morphine equivalent average, an increased use of pre-operative analgesics, and an increased percentage of antibiotics administered 60 minutes prior to incision. After the successful pilot, the ERAS program expanded to include cardiothoracic, thoracic, and urology surgical services. For their success in promoting and increasing recovery times among surgical patients, we recognize Mainline Health as the third-place recipient of the 2019 Delaware Valley Patient Safety and Quality Award. Pennsylvania has one of the highest rates of opioid-related deaths in the country. The largest concentration of overdoses in Pennsylvania is in north-central Philadelphia. To tackle this epidemic, Temple University Hospital formed a system-wide substance abuse task force and developed the strategy for addiction medicine. The program was coordinated with municipal and state agencies to address prevention, treatment, and recovery services. Their central goals were to improve access to medication-assisted treatment, engage the community, strengthen opioid addiction risk assessment, implement appropriate physician prescribing practices in inpatient and ambulatory settings, update education, and foster employee wellness. To achieve their objectives, the team formed subcommittees across the health system. Key areas of focus were at the main academic facility and behavioral health facility, and also included specialists and community practice physicians. Since the task force was formed in 2016, there has been a 44% reduction in ambulatory prescribed opioids across the health system. During this same period, the use of alternative anesthetic techniques increased 225%. Supporting reductions in post-operative opioid utilization. For their dedication and work towards ending the opioid crisis, we recognize Temple University Hospital as the second-place recipient of the 2019 Delaware Valley Patient Safety and Quality Award. Patient safety procedures are critical for quality care. Tomorrow's providers play a key role in preventing errors from reaching patients and must understand environmental risks, mitigation strategies, and event reporting methods. Unfortunately, the traditional style of teaching lacks the hands-on training interns need to identify safety priorities. Thomas Jefferson University Hospital wanted to try a new teaching approach. So they created a Patient Safety Escape Room, or PSER, a simulation featuring 9 patient safety priorities. The PSER team designed a space to mimic a clinical care setting. It includes a range of patient safety hazards in the room, as well as throughout the fictionalized patient chart. During the simulation, teams of interns work together to identify and mitigate the safety hazards. In doing so, they uncover puzzles which ultimately reveal login information for the hospital's event reporting system. To escape the room, the intern teams must successfully submit an event report detailing the patient's safety hazards. Over 250 learners have been trained in the PSER. All intern teams were able to successfully submit an event report as part of the simulation. 97% thought the PSER was relevant to their practice. Other results include higher intern confidence in identifying institutional patient safety priorities and improved teamwork scores. For their innovative approach in patient safety training, we recognize Thomas Jefferson University Hospital as the first place recipient of the 2019 Delaware Valley Patient Safety and Quality Award.